Your doctor just told you to get your blood pressure down to 120/80. You're doing everything right. Taking your pills every day, cutting out salt, following every rule. But here's what's happening. You're getting dizzy when you stand up. You feel weak, more tired than you've ever been. And last week, you almost fell. Here's the question nobody's asking. What if the number you're chasing is actually putting you in danger? What if trying to get perfect blood pressure is quietly increasing your risk of falls, kidney problems, and even shortening your life? I'm about to show you why the standard advice about blood pressure completely changes after age 70, what the research actually says about the safest numbers for older adults, and why some people feel dramatically better when their pressure goes up slightly, not down. I'm Dr. Megan Foster. I've worked in clinical and surgical settings for over 24 years, mostly with older adults dealing with blood pressure issues, falls, and heart disease. This isn't medical advice, it's education. But I need to tell you something. I've seen more harm from overtreating blood pressure than from leaving it slightly elevated. That's not what most people expect to hear. And understanding why this happens could genuinely change your life. Here's the most important thing you need to understand right now. Blood pressure targets are not one size fits all, especially after 70. For younger adults, lower blood pressure is usually protective. For older adults, it can be dangerous. Why? Because aging fundamentally changes how your arteries, kidneys, and nervous system handle pressure. At a certain point, pushing blood pressure too low doesn't protect your organs, it starves them. That's what guidelines rarely explain. This video isn't about chasing ideal numbers. It's about keeping blood flowing safely to your brain, kidneys, and heart without creating new risks. Same measurement, completely different meaning. By the time we're done, you'll understand what blood pressure ranges are actually safest as you age, why 120/80 isn't always ideal for seniors, how low blood pressure increases your fall and injury risk, what symptoms tell you your pressure might be too low, and how to have a much smarter conversation with your doctor. This is practical, this is realistic, and it could prevent real harm. Before we go further, if you're thinking long-term about your health, your circulation, your brain function, and aging well overall, I've put together a longevity guide that explains how blood pressure, inflammation, medications, sleep, and daily habits all connect as we age. It's calm, it's science-based, and it's designed specifically for people who want health without extremes. You'll find the link in the description whenever you're ready. If this kind of clarity matters to you, go ahead and subscribe now so you don't miss the next video. And drop a comment below telling me what your biggest concern is about blood pressure. I read every single one. Now let's talk about what the research actually shows when it comes to blood pressure in older adults, and why moderation, not perfection, is often the safer path. Several large studies following adults over 75 found something surprising. People with very low blood pressure around 120 or lower had higher risks of falls, kidney injury, dizziness and fainting, and even higher overall death rates. Meanwhile, those with moderate blood pressure lived longer. Lower isn't always better once your arteries stiffen and your reflexes slow down. This is the opposite of what most people have been taught their whole lives. And it's creating a massive problem because doctors are still using the same targets for 75-year-olds that they use for 45-year-olds. Let me explain what's happening inside your body as you age. Your arteries lose their elasticity. They become stiffer. That stiffness means your body often needs slightly higher pressure to push blood to vital organs, especially your brain. Lower pressure might look good on paper, but functionally, it can reduce blood flow to the areas that need it most. This is why some older adults feel worse, not better, after their doctor aggressively lowers their blood pressure. They're told their numbers are perfect, but they can barely get out of bed. Here's where it gets really interesting. Your body has these sensors called baroreceptors. They help your blood pressure adjust automatically when you stand up. With age, these sensors respond more slowly. So when your blood pressure is already on the low side, standing up can cause a sudden dangerous drop. This is called orthostatic hypotension, and it's one of the leading causes of falls in seniors. Falls aren't minor events after 70. A fall can mean a broken hip, loss of independence, even death. So when we're obsessing over getting blood pressure to 20, we might be trading one risk for a much more immediate, dangerous one. There's another factor most people don't know about. Blood pressure medications stay in your body longer as you age. Your kidneys don't filter as efficiently. Your liver doesn't break down medications as quickly. The same dose that worked perfectly at age 55 might be way too strong at 75. This creates a higher risk of excessive drops in pressure, dangerous nighttime lows, and kidney strain. More medication doesn't always mean better control. Sometimes it means more problems. Let me share what one of the largest studies actually found. Researchers followed over 15,000 adults aged 75 and older for 5 years. Here's what they discovered. The lowest death rates were in people with systolic blood pressure between 130 and 140 in healthy seniors and 135 to 145 in adults aged 75 to 84. When blood pressure dropped below 120, there was a 28% higher risk of falls, increased kidney injury, and about a 14% higher overall death rate. When blood pressure went too high, above 150, there were more cardiovascular events like heart attacks and strokes. The safest zone was right in the middle, not at the extremes. This completely contradicts the idea that lower is always better. Now, why don't more doctors know this or talk about it? Part of it is that medical guidelines are slow to change. They're based on large population studies that often don't separate out older adults. Part of it is that doctors are trained to fear high blood pressure because it does cause real harm in younger people. And part of it is that it's just easier to follow a simple rule, get everyone to 120/80, than to individualize care for each patient. But here's the truth. Two people can have the exact same blood pressure reading and need totally different treatment. Age, frailty, kidney function, other medications, and how you actually feel all matter just as much as the number. Let me tell you about Mrs. Chen. She came to see me at 78 years old. Her blood pressure had been brought down to 118/72. Perfect by the guidelines. But she was miserable, dizzy every morning, scared to walk to the mailbox, exhausted all the time. Her doctor kept telling her the numbers were great. I had her check her blood pressure lying down and then standing up. Lying down, it was 118/72. Standing up, it dropped to 92/58. That's a massive, dangerous drop. We carefully reduced one of her blood pressure medications. Her standing pressure came up to 108/65. Still quite low, but she felt like a different person. No more dizziness. Energy came back. She could walk her dog again. The number went up, but her quality of life and her safety improved dramatically. This brings up something critical that most people miss. Office blood pressure readings miss a lot. They're just a snapshot. Home monitoring gives you a much truer picture of what's happening day to day. And checking your pressure both lying down and standing up can reveal dangerous drops that a seated reading will never catch. If you're having symptoms like dizziness, fatigue, or brain fog, that's information, not weakness. Your body is trying to tell you something. Here's what I want you to understand about symptoms. If you feel lightheaded when you stand, if you're more tired than usual, if you feel weak or shaky, if your thinking feels foggy, if you're unsteady on your feet, these are not just normal parts of aging. They could be signs that your blood pressure is too low for your body to function well. Don't ignore them. Don't let anyone tell you it's just in your head. These symptoms matter. They're your body's warning system. Now let's talk about what happens at night, because this is another piece most people don't know about. Blood pressure naturally drops when you sleep. That's normal and healthy. But if you're taking blood pressure medication, especially if you take it at night, your pressure can drop too low while you're sleeping. This reduces blood flow to your brain and kidneys for hours at a time. Over months and years, this can contribute to cognitive decline and kidney damage. Some studies have found that people whose blood pressure drops too much at night have higher rates of dementia and kidney disease. This is why the timing of your medication matters just as much as the dose. Let me explain something about kidney function because this is where things get even more complex. Your kidneys need a certain amount of pressure to filter your blood properly. If blood pressure drops too low, your kidneys can't do their job. They start to decline. Then as your kidney function gets worse, it becomes harder to regulate blood pressure and medications. It's a vicious cycle. I've seen patients whose kidney function dropped significantly after their blood pressure was lowered too aggressively. And once kidney function declines, it rarely comes back. Here's something else that's rarely discussed. Brain function depends on steady, adequate blood flow. Your brain is incredibly demanding. It uses about 20% of your body's oxygen, even though it's only about 2% of your body weight. When blood pressure drops too low, blood flow to the brain decreases. This can cause temporary confusion, dizziness, and lightheadedness in the short term. But over time, chronically low blood flow may contribute to cognitive decline. Some research suggests that in older adults, having blood pressure that's too low is associated with faster cognitive decline and higher dementia risk. The brain needs perfusion. It needs blood flow. And if we're cutting that flow in the name of perfect numbers, we might be doing more harm than good. Let's talk about medication side effects because this is huge. Blood pressure medications are not benign. Diuretics, the water pills, can cause dehydration, electrolyte imbalances, and frequent urination that disrupts sleep and increases fall risk when you're rushing to the bathroom at night. Beta blockers can cause fatigue, depression, and exercise intolerance. ACE inhibitors can cause a chronic cough and elevated potassium levels. Calcium channel blockers can cause swelling in the legs and constipation. And all of these side effects get worse as you age because the medications stay in your system longer. Sometimes the cure is worse than the disease. I had a patient, Mr. Rodriguez, 81 years old. He was on 4 different blood pressure medications. His pressure was 115/68. Perfect, right? But he could barely stay awake during the day. He had no energy. His daughter thought he was developing dementia. We carefully tapered him down to 2 medications. His pressure went up to 135/78. Not perfect by the old guidelines, but he came back a month later and told me he felt 10 years younger. He was gardening again, playing with his grandkids. His mind was sharp. The difference was night and day. This happens more often than you'd think. Now, I'm not saying high blood pressure is good. I'm not saying you should stop your medications. What I'm saying is that the target needs to match the person. If you're 82 and frail, your target should probably be different than someone who's 52 and running marathons. If you have kidney disease, your target might need to be different. If you're having frequent dizzy spells and falls, your target definitely needs to be reconsidered. Medicine is supposed to be individualized, but when it comes to blood pressure, we've been following a one-size-fits-all approach that doesn't make sense for older adults. Let me give you some practical guidance. If you're over 75 and your blood pressure is being treated, here's what you should do. First, monitor your blood pressure at home. Get a good automatic cuff, check it at different times of day, write it down. Second, check your blood pressure both sitting and standing. Sit quietly for 5 minutes, check your pressure, then stand up and check it again after 1 minute and after 3 minutes. If it drops by more than 20 points, systolic or 10 points diastolic, that's orthostatic hypotension, and you need to tell your doctor. Third, pay attention to how you feel. Are you dizzy, tired, weak, foggy? These symptoms matter just as much as the numbers. Fourth, ask your doctor if your blood pressure target makes sense for your age and overall health. Don't be afraid to have this conversation. A good doctor will listen. Here's what the conversation with your doctor should sound like. Doctor, I've been reading that blood pressure targets might be different for older adults. My pressure is 118/70, which seems good, but I'm feeling dizzy and tired a lot. Could my pressure be too low for me? Can we check my standing blood pressure? I'd like to understand if my current target is right for my age and health. Most doctors will appreciate that you're informed and engaged. If your doctor dismisses your concerns or refuses to discuss it, that's a red flag. You deserve a doctor who listens and individualizes your care. Let's talk about what you can do beyond medication. Lifestyle factors matter enormously for blood pressure, especially as you age. Staying hydrated is critical. Dehydration makes low blood pressure worse. Many older adults don't drink enough water. Aim for at least 6 to 8 glasses a day unless your doctor has told you to restrict fluids. Salt isn't always the enemy. If you have low blood pressure, a moderate amount of salt can actually help. This is the opposite of what you've been told, but it's true for people with low blood pressure. Talk to your doctor before adding salt, but don't assume that less salt is always better. Exercise is incredibly important, but it needs to be the right kind. Resistance training, lifting light weights, or using resistance bands helps maintain muscle mass and supports blood pressure regulation. Walking is great, but if you're feeling dizzy, start slow and consider using a cane or walker for safety. Avoid exercising in the heat, which can drop blood pressure further. And always move slowly when you stand up or get out of bed. Sit on the edge of the bed for a moment before standing. This gives your body time to adjust. Compression stockings can be helpful if you have orthostatic hypotension. They prevent blood from pooling in your legs when you stand up. They're not glamorous, but they work. Elevating the head of your bed slightly, just 4 to 6 inches, can reduce nighttime blood pressure drops. You can put blocks under the legs at the head of your bed. It's a simple change that can make a real difference. Let's talk about timing of medications because this is something you can discuss with your doctor that might help. If you're taking multiple blood pressure medications, spreading them out during the day rather than taking them all at once can prevent big drops. If you're having nighttime lows, taking medications in the morning instead of at bedtime might help. These are small adjustments that can have big effects. Here's something most people don't realize. Some over-the-counter medications and supplements can affect blood pressure. NSAIDs like ibuprofen can raise blood pressure. Decongestants can raise it. Licorice root can raise it. On the flip side, some supplements like CoQ10, magnesium, and garlic can lower blood pressure. If you're already on blood pressure medication, adding these without knowing can drop your pressure too low. Always tell your doctor about everything you're taking, including vitamins and supplements. Now let's address fear because I know many of you watching this have been taught to be terrified of high blood pressure. And that fear is understandable. Uncontrolled high blood pressure does cause heart attacks, strokes, kidney failure, and other serious problems. That's real. But what I'm talking about is the difference between 150 and 135. I'm talking about whether 120 is better than 135 for a 78-year-old. I'm talking about the nuance that gets lost when we treat numbers instead of people. You can take blood pressure seriously without living in fear. You can monitor it, manage it sensibly, and still have a good quality of life. Let me share one more story. Mrs. Patterson was 86, sharp as a tack, independent, living alone. Her blood pressure was 148/82. Her doctor wanted to add another medication to get it below 130. She asked me what I thought. I looked at her overall health, no history of heart attack or stroke, kidneys functioning well, no symptoms, active and independent. I told her that in my opinion, 148/82 at age 86 was reasonable, and that adding another medication carried risks of dizziness and falls that might outweigh the benefits. She decided not to add the medication. That was 5 years ago. She's now 91, still independent, still sharp, still living on her own. Her blood pressure is still around 145/80. She's doing great. Would she have been better off at 125/75? Maybe. Or maybe she would have fallen, broken a hip, and lost her independence. We'll never know. But what we do know is that she made an informed choice that felt right for her life. That's what this is really about, informed choices. Understanding the trade-offs, knowing that blood pressure management isn't black and white. There's a range of reasonable approaches, and the right one depends on you, your age, your overall health, your other medical conditions, your medications, and your personal values and goals. Let's talk about what happens when blood pressure is too high. If your blood pressure is consistently above 160 over 100, that does increase risk of stroke, heart attack, heart failure, kidney disease, and vision problems. Those risks are real and significant. Treatment is important, but the question is, what's the right target? For a healthy 55-year-old, getting blood pressure to 120 over 80 or even lower might be ideal. For an 85-year-old with multiple health issues, 140 over 85 might be much safer. The key is finding the sweet spot where you're protected from the risks of high blood pressure without creating the risks of low blood pressure. Here's where guidelines are starting to change, slowly. Some newer recommendations suggest that for adults over 65, especially those who are frail or have multiple health conditions, a target of 130 to 140 systolic is reasonable. That's higher than the 120 target that's often pushed. And for adults over 80, some guidelines suggest up to 145 to 150 might be acceptable, especially if lowering it further causes symptoms. This is progress, but many doctors haven't updated their approach yet. They're still using the same targets for everyone. Let me explain what frailty means in this context because it's important. Frailty isn't just about age, it's about overall physical condition. A frail person has weak muscles, low energy, slow walking speed, and often multiple medical conditions. A robust person might be 85 years old but still active, strong, and healthy. Blood pressure targets should be different for these two people, even if they're the same age. A frail person is at much higher risk from low blood pressure and falls. A robust person can probably handle lower blood pressure safely. This is why cookie-cutter medicine doesn't work. Now let's talk about what to do if you think your blood pressure might be too low. First, don't stop your medication suddenly. That can be dangerous. Second, start documenting. Check your blood pressure at home regularly. Note any symptoms like dizziness, fatigue, or near falls. Check your standing blood pressure. Write everything down for at least 2 weeks. Third, make an appointment with your doctor specifically to discuss your blood pressure management. Bring your documentation. Be clear about your symptoms. Ask if your target is appropriate for your age and health. Ask if any medications can be reduced or stopped. Be an active participant in your care. If your doctor isn't willing to have this conversation or dismisses your concerns, you have options. You can get a second opinion. You can ask to see a geriatrician, a doctor who specializes in older adults. You can ask to see a cardiologist. You deserve a doctor who treats you as an individual, not just a number on a chart. Here's something else to consider. Blood pressure varies throughout the day. It's typically lowest at night and highest in the morning. It goes up with stress, pain, and activity. It goes down when you're relaxed. A single reading doesn't tell the whole story. This is why home monitoring over time is so valuable. It gives a much more complete picture than one reading in a doctor's office where you might be nervous. White coat hypertension is real. Some people's blood pressure goes up in medical settings because of anxiety. If your blood pressure is high at the doctor's office but normal at home, you might not need medication at all. Ambulatory blood pressure monitoring, where you wear a device that checks your pressure automatically throughout the day and night, can be really helpful in cases like this. It's worth asking about if there's a big difference between your office and home readings. Let's talk about the role of stress and mental health because this matters more than people realize. Chronic stress keeps your blood pressure elevated. Anxiety can cause spikes. Depression is associated with both high and low blood pressure. Managing your mental health is part of managing your blood pressure. This might mean therapy, meditation, yoga, spending time with loved ones, or medication for anxiety or depression if needed. It's all connected. Sleep is another huge factor. Poor sleep raises blood pressure. Sleep apnea, where you stop breathing repeatedly during sleep, causes significant blood pressure elevation and increases heart disease risk. If you snore loudly, wake up gasping, or feel exhausted despite sleeping enough, talk to your doctor about a sleep study. Treating sleep apnea can improve blood pressure significantly, sometimes enough to reduce or eliminate the need for medication. Here's something practical about diet. You don't have to follow a perfect diet. You don't have to eliminate everything you enjoy. But some general principles help. Eat plenty of fruits and vegetables. They provide potassium, which helps balance sodium and supports healthy blood pressure. Choose whole grains over refined grains most of the time. Include some healthy fats like olive oil, nuts, and fish. Limit processed foods, which are often very high in sodium. Stay hydrated and don't go to extremes. A little salt is fine for most people, especially if your blood pressure runs low. A treat now and then won't hurt you. Consistency matters more than perfection. Let's address alcohol because this comes up a lot. Alcohol can raise blood pressure, especially if you drink regularly or heavily. But moderate drinking, 1 drink a day for women and 2 for men, doesn't seem to cause problems for most people. If you're trying to manage blood pressure, cutting back on alcohol might help. But you don't necessarily have to eliminate it completely unless your doctor recommends it. Caffeine is another question I get often. Caffeine can cause a temporary spike in blood pressure, but for most people, it doesn't have a long-term effect. If you're a regular coffee drinker, your body adapts. That said, if you notice that coffee makes you feel jittery or anxious or spikes your blood pressure significantly, it might be worth cutting back. But for most people, moderate caffeine intake is fine. Here's where I want to bring everything together. Blood pressure management in older adults should be about more than just numbers. It should be about maintaining quality of life, preventing falls and injuries, protecting brain and kidney function, and supporting independence. Sometimes that means accepting a blood pressure that's a bit higher than the textbook ideal. Sometimes it means reducing medications instead of adding more. Sometimes it means paying more attention to how you feel than to what the monitor says. I want you to think about what matters most to you. Is it living as long as possible? Is it maintaining independence? Is it having energy to do the things you love? Is it avoiding falls and hospitalizations? These are all valid goals, and they might lead to different decisions about blood pressure management. There's no single right answer. The right answer is the one that aligns with your values and your life. Let me give you an example. If you're 76 years old, active, healthy, and your main goal is to prevent a heart attack or stroke, getting your blood pressure to 130 or even 120 might make sense, as long as you're not having side effects. But if you're 84, frail, have had several falls, and your main goal is to stay out of the hospital and maintain independence, a target of 140 or even 145 might be much safer. Both approaches are reasonable. They're just optimized for different situations. Here's what I want you to remember. You are not a number. You're a person with unique health circumstances, goals, and values. Blood pressure is one piece of your health, not the whole picture. Lower isn't always better, especially as you age. Symptoms matter just as much as measurements. Home monitoring and standing blood pressure checks give you critical information that office visits miss. Medications have side effects and risks that increase with age. Individualized care is better than following rigid guidelines. And you have the right to be an active participant in decisions about your health. Now, if this video helped you understand blood pressure in a new way, I'd love to hear about it. Drop a comment below and let me know what you learned or what questions you still have. And if you want deeper, calm, science-based guidance on blood pressure, aging well, and longevity, check out the guide linked in the description. It goes into much more detail on how everything connects. Subscribe if you want more videos like this that cut through the confusion and give you practical, realistic information you can actually use. I'll see you in the next one.